Literature Library.
Featuring me, the Lip Crit.
So Sharon, here we are in the Literature Library, and I believe the selection for this episode was yours. We're looking at a special pressure ulcer guidelines.
My favorite topic, pressure ulcers, prevention and treatment, the clinical practice guidelines that have been developed by the National Pressure Ulcer Advisory Panel and the European Pressure Ulcer Advisory Panel.
Tell me a little bit about this, the guidelines. Exactly what does this allow us as clinicians to gain after reading this, and what's the usefulness of this guideline?
Okay, well, there is certainly a wealth of information that the two authorities, the two panels, worked 4 years in a collaborative effort to develop best practice, if you will, clinical practice recommendations on the care of patients with pressure ulcers.
So this is an international effort.
Absolutely.
I'm sure you well recognize and probably know many of the folks that were on this panel, and reading through the list of names, certainly well-experienced and knowledgeable clinicians in the area of pressure ulcers. I mean, who better than to be making recommendations on guidelines for the treatment of pressure ulcers than this esteemed host of cadre. So, Sharon, if we look into this document here and these guidelines and we interrogate the writings, we essentially find that it's broken down into two main areas, pressure ulcer prevention and pressure ulcer treatment.
Correct.
And each one of those categories has a number of smaller sections, if you will. For example, if we look at prevention, there's evaluation of etiology and risk assessment and skin assessment, nutrition, repositioning, support surfaces, and there's a category looking at special populations of patients. Now, it's my understanding that each one of these areas is substantiated by guidelines, and the guidelines are essentially rated based on available evidence. Is that right?
That is correct.
So what is the strength of the evidence supporting these guidelines?
That's a really good question, Jeff.
It certainly is.
Oh, hello, LitCrit.
Well, hi, LitCrit. Thank you for joining us. We are discussing the National Pressure Ulcer Advisory Panel and European Panel guidelines. Maybe you can help us out.
Can you explain the strength of the evidence rating used to evaluate these guidelines, LitCrit?
Certainly, Sharon. I'm greatly obliged to be of assistance. The 3 levels of evidence used in this guideline are rating A, recommendations, and are supported by direct scientific evidence from properly designed and implemented controlled trials on pressure ulcers in humans. B, recommendation is supported by direct scientific evidence from properly designed and implemented clinical series on pressure ulcers in humans. The final one, C, are recommendations supported by indirect evidence and/or expert opinion.
Wow, that was a mouthful.
Well, that was actually an abbreviated summary.
As always, LitCrit, thank you for your expertise.
Thank you, LitCrit. See you next time.
Bye.
Well, Sharon, that was fabulous. As always, our LitCrit is an incredible wealth of knowledge. But, let's spend the last few minutes of this segment looking into some detail. Now, one of the sections under prevention is repositioning. And
it is.
What does that relate to?
Well, repositioning is really addressing areas where the patient is in a lying-in state. It's also addressing seated individuals. It's looking at the importance of redistribution, also patient comfort, looking at the frequency of when someone is repositioned or turned.
Certainly. I mean, all these guidelines are important, but, repositioning, I think it's probably top on the list, at least in my book. Now, if you look at repositioning in greater detail, there's a couple of these guidelines that are actually rated at A levels of evidence. Is that correct?
Yes, actually, in this specific section in repositioning, there are 3 level A areas of expertise.
So the first is repositioning should be undertaken to reduce the duration and magnitude of pressure over vulnerable areas of the body. The next guideline that has a strength of evidence rated as an A is the frequency of repositioning will be influenced by variables concerning the individual and the support surface in use. And the third is repositioning frequency should be influenced by the support surface used. I think, putting those 3 together, I mean, they really get at the heart of preventing pressure ulcers?
Absolutely, and I think especially looking at repositioning and the work of DeFleur and looking at, is there any value to the Q2-hour turning schedule, or can we extend that, as his research has shown, to 4 hours if you are on a viscoelastic foam mattress, for instance. So these are great guidelines, something that all of us in clinical practice should have in our practice, should be reviewing, and should be utilizing and making sure we are doing best practice.
Well, you know, there are areas of controversy everywhere in wound care. Clearly, pressure ulcers is another area of controversy, like we talked about in our talking points.
Absolutely, and I think, you know, you did a good job of bringing up those particular challenges that we have with pressure ulcers.
And, you know, as far as repositioning, you know, I think BBJ illustrated very nicely the importance of turning in the workbench segment. So this is really all fitting together very nicely, Sharon.
It really is, and I think BBJ's demonstration actually shows us proper positioning for the patient, but also the body mechanics for the caregivers and us, the practitioners.
Well, I know you have a copy of that, but I'm sure there's members of our viewing audience that do not. Where can they get a copy of these guidelines?
You can go on the website for NPUAP. It is www.npuap.org and go under guidelines, and you will get how to order your own very own copy.
If you don't have a copy in your library, we strongly suggest that you obtain these guidelines and start reading through them, implementing these guidelines in your clinical practice.